Good evening, friends, and I am so happy to invite Dr. Jayaram S, who is from Puducherry, and he has got AIIMS rank after the part two AIIMS. He got the rank two as well as a common merit list rank two, and he's an aspirant of neurology, a core aspirant of neurology. He has been able to procure quiz prizes, national as well as international level, many times, even including two international quiz competitions, including neurology. And congrats, Jayaram. Congrats.
Thank you very much, sir.
How are you feeling now, right now? Because you have got a very wonderful rank in the NEET also, but
Yes,
you
sir.
choose INI above NEET. And how are you feeling now? Procuring the second rank after the phase
Yes,
two.
sir. I am very happy, sir. Myself and my family are very happy. And actually, this time it was a tough paper, so I didn't
Yeah.
expect this rank. But after working, like after preparing for 4 months fully for this one, and I am after getting this as a reward, I was very happy. So
Actually, in
thank you
fact,
very much, sir.
the theory paper was very, very, very tough. Like
Yes, sir.
nothing like pattern. It was totally a new, like in
Yes,
especially
sir.
neurology. It was into the core neurology. They asked questions even directly from Bradley. They had kept some pictures on the Bradley also.
Yes, sir.
And you did. I'll give you a brief introduction. You did your MBBS from Indira Gandhi from Puducherry, and then your MD from JIPMER,
Yes,
and you had cleared your MD exam like 2022 July, right?
yes, sir.
Yeah.
Yes,
So,
sir. Completed recently.
yeah. How was your preparation? How did you plan for, like you told that you got a very good rank in the NEET also. And so whether
Yes,
you
sir.
were preparing for INI SS only or you're preparing for both the exams, or how was your preparation?
No, sir. My primary target was to prepare for NEET SS exam only, sir. Because I want to do my DM in a Central Institute. Because my MDA got finished in JIPMER, so I was very much inspired to continue in a Central Institute. But usually, NEET SS has 80 questions. So in that, this medicine part will be a part of the like 30 questions. 25 to 30 questions will come from medicine, and remaining 50 from core branch neurology. So for preparing that NEET, I have studied. So Harrison, I was initially preparing during my MD days, and then to NEET, difference between NEET and NESS is NEET has all the subjects. So we can't choose specialty at the initial. So only at the end after the results are announced, then only can choose the specialty. So I was preparing for I took it as an opportunity to prepare it for the medicine part, the 30 questions. So I was preparing all the topics and revised all the topics which I studied recently. And Harrison Neurology, I studied from page to page. I studied during that time. And recent 21st edition was released recently, like January, at that time only. So I was when I was reading, I was highlighting the points which were difficult or which has to be seen again, like that. And whatever images to be seen again on classifications tables from Harrison, I took a screenshot or prepared them separately.
Yeah.
So and like it, so NEET I basically concentrated for the medicine part of NESS. Then I was preparing each all the topics for NESS from core neurology. So like movement disorders, seizures, then myopathies, so and brainstem stroke syndromes, like that. Every topic I was reading. So in such a manner, like whatever question they ask should be from this. In all aspects I was covering. So from clinical aspect as well as from the updates as well as from the neuroanatomical point of view. So each topic I was preparing 2 days time, like that I allocated, and I was separately preparing for each of them. And Marrow was helpful for during this preparation time, especially the pearls in Marrow and the MCQ sessions in Marrow, like what are the close mimics, how to rule out the thing and narrow down the option, and then mock tests, initial mock test, like a small mock test, like 25 questions, like that. And then the final mock test, I got rank 10. I was preparing that. It was a difficult paper. It was asking, like, it has similar thing, like 30 questions from medicine and 50 questions from neurology. So in that, approximately I was 10. So each time I was getting a motivation. So I have to prepare more, not to be in top 5. So the preparation was like that.
And even you procured a rank of 10 in the Marrow exams, right? In the last exams.
Yes, sir. Yes, sir.
Yeah. And like you were telling about your preparation, how was you doing how did you did your preparation with Marrow, and or any apps you're using, any exams you're writing? How did you use that? along with your what are you reading with Harrison and all, because especially when you take the ANA SS sustain and even the NEET also, there are questions used to come like Harrison actually has everything is there in the Harrison, but it is difficult to understand without knowing the concept, because it's like a full page of Bradley will be concise in one sentence in Harrison, like that it will goes like that, very
Yes,
much
sir.
concise. So it is very difficult to approach in that way. So how did you approach for like those tables of Harrison and all those things, which seems to be very tough, and without conceptual knowledge is difficult to approach. And second thing is, how did you use the like Marrow per se? You were telling that you were using the MCQ and all. Did you use the video part, or how it was? How did you go through that area?
Sir, initially understanding the core concept is the important thing, sir. Because like question papers in a central institute exam we can't predict, but if you understand the core concept, whatever complex they change or twist they give, you can solve the paper. Although you can't exactly know the answer, at least we can. It will help in solving by ruling out the other close mimics. So initially I was seeing the videos like Marrow, especially that myopathies part was extensive. That LGMD and limb girdle muscle dystrophy, then myopathies, then congenital myasthenic syndromes, then autoimmune encephalitis, leukodystrophy. These things were very elaborately given in Marrow. It was not available in other sources actually. The textbook also it was given, but it is not that much clear in case scenario based discussion or narrowing clinically how to differentiate from other localization in the neuraxis. Like that, it was very difficult when we study straightly in textbook. So first is understanding the anatomy part, like initially like blood supply of the brain, then each lobe or functions, physiological part, then myopathies that A alpha, a bit of fibers thing, as well as cerebellum functional anatomy and functional localization, cerebellar syndromes, how to localize based clinically. Like the anatomical part, first you have to be clear. Then the video part, like each thing, case scenario, how to approach based on onset, progression, and duration, how to approach it clinically. Then each type, subtype, and each is clinical manifestations. Then finally, after reading the core concept, then we can work out MCQ and know, like after reading the thing, whether we are able to solve correctly or not. Like that, we get this.
That is what.
Yes, sir.
You can continue.
Straightly going to MCQs would be very difficult, but understanding the core concept is very important. Like when compared to previous NESS papers, this time it was very difficult. Like straight pictures from Bradley were asked, especially myopathies. Difficult one was there. And LGMD new classification, 2018 classification, dominant and recessive, D1, D2, D3, D5. These are the options given. So based on case scenario, whether if you know whether it is a calpainopathy or collagen 6 or what type of thing is there and corresponding alphabet subtype of LGMD, then only we will be able to answer that question. So understanding the core concept is the first one. Then practicing, then clear with the concepts and tables and classification. And third one is revising repeatedly with mock test as well as seeing the images and tables frequently will help in achieve. And I have collection, like I have made a separate tables whichever is difficult for me, like LGMD classification, then congenital myopathies and myasthenic syndromes, then trials which are related to strokes, all the trials related to strokes, thrombolysis, mechanical thrombectomy, and multiple sclerosis trials. So I have made it and stick in near my study table. So daily when I am waking up as well as going to bed, I will used to revise that. So it was very helpful in the time, even though the questions are tough and the exam stress is there. So since I'm reading it daily, it was easy for me to narrow the select option.
Yeah, when you take neurology, actually there is two part of questions. One part is something like more conceptual, and second part is like what you're telling, LGMD, D1, D2, D3. So those things
Yes, sir.
actually, even if you study 100 times, you will forget. Unless and otherwise, you need to go through it daily, and before the exam, you go through that values, tables, and everything. Those things like classical exam is LGMD, D1, D2, D3, that things. So
Yes, sir.
such things, what you're telling, what you're doing, the exact thing I was suggesting last year also. Like those things, you feel like this everything depends on a personal choice. Like if it is difficult for you, you should revise it daily. Revision is something which help. That is also I was also thinking. And like what you're telling is exactly correct. Like the INISS this time also paper was looking tough. But if you go to the most of the questions that many are clinical oriented, if you have the proper
Yes, sir.
concepts, you can arrive at the differentials and then you can go to the answers. It is not like a straightforward questions. It was
Yes,
like
sir.
more of practical applicability all to there, and then you're even the need, those patterns keep on coming now, especially in neurology. And what I feel is when you're preparing for neurology, you will get an advantage in that, maybe personally because I love neurology, maybe because of that I am feeling that. Because when you're preparing for the NEET also, what happens is like the many questions comes to neuro, and neuro questions seems to be more clinical oriented and little bit tougher questions. So if you have a good base in neuro, it will be always helpful. Whatever is a pattern, if you have a good base, you can build up. Depend upon the pattern. Patterns keep on changing. You don't know what happened next year. Some case will come every day. India, the patterns keep on changing. That is a joke of India. Every time, somebody will file a case, new pattern, new allotment pattern, everything will come. But the subject will not be changing. Subject will be the same thing. The concept will be the same. So. And the next question is like before coming to the phase 2, I just want to ask that like when I was seeing, like we were talking to you, like you were having multiple prizes in quiz competition, including neurology international conference also. So you were like core into neurology. So why, what made you like neurology? Whether it was from your UG days or it happened during PG days, or what was the exact reason why you are a core follower of neurology?
So UG days, UG days I liked medicine, general medicine. Then after joining MD, initial phases, I was learning procedures. So in that, this lumbar puncture and CSF analysis, these things, and especially patient as presents with very, very different patterns, and the clinical diagnosis is very challenging in neurology. So even though the treatment is limited, but now emerging treatments and intervention neurology is also coming up. So the challenging diagnosis, and localization in a neuroaxis, these two things has inspired me.
Yeah, and actually many of the, even when I was taking neurology and when I was thinking about taking neurology, or when I was telling like neurology is so beautiful, many of the students and many of the even my colleagues who did with me MT, they used to ask, why are you going for neurology? There is no treatment for that. But actually, it is not like that. Neurology, there is plenty of treatment options are there. Like neurology is vastly changing, and more than if you have a CKD or if you have a CLD or if you have a heart failure, it is not going to completely cure it. Just like that only, but you can give a lot of immunological things are coming up, a lot of treatments are available. You can provide a better life if you diagnose early. So, like you're telling that you like neurology, and whether there was like anything specific, like you were liking medicine during your UT life, because medicine is the subject. Those who like neurology, obviously, most of people will be into medicine, then later turn out to be neurology, and those who are a little bit surgical inclination will go to the cardio or gastro, something like that. So, what was your per se during your PG life? Like anything was there? For me, why my inclination came to neurology is because, first of all, in my PG days, there was a wonderful neurologist there in my UG, my PG college. He was inspiration to me and many of others who worked with us. So, like, there any particular incidents was there, like which put forward to neurology, or something which you personally feel it was very beautiful and compared to other thing? Why you anything was there like that? Is there?
Sir, one or two case scenarios are there, sir. Like initially, patient presented with a psychiatric manifestation, hallucination. So initially,
Yeah.
from EMS, like emergency medicine side, they were given psychiatry opinion, and some psychiatric disorders they were thinking, like schizophrenia or the delirium kind of thing. But later, it's a young patient. Then psychiatric part they were not able to diagnose, and then medicine opinion was taken. And from that, LP was done. And in that patient, we have suspected this autoimmune encephalitis, NMDA encephalitis, because young female. And then, we have done CSF, and then we have sent to demands for analysis, and it came as anti-NMDA positive. Then we have ruled out infection, and then we have treated with rituximab. Then patient has improved clinic, and then screening for ovarian malignancy was done, and it was found to be positive and early diagnosis. So the ovarian malignancy will take long time to manifest, but neurological manifestation was early one, and it was diagnosed in acute period. And after the treatment, the patient completely resolved. So some clinical diagnosis are very interesting. So if it is done early, treated with appropriate drugs at an early intervention, patient can completely resolve. So this one thing was there.
And this story what you're telling tells me that you have a wonderful exposure to neurology during your MD days also. That
Yes,
is
sir.
the main reason. Maybe that is the main reason which you were seeing those cases. What happens in luckily or unluckily, actually, it is happening in many of the major medical colleges also. Like these go to super specialities, and this core neurology will go to super speciality, and medicine BS might not be that much exposed. They will come in the super specialty posting and sit and go. That proper workup not done by the medicine PGs. If you like what you're telling, like if you're involved in a case and working up a case, you will understand it better, and then you like that area. If suppose if there is a question comes from that area also, like if you have a clinical exposure in a particular area, that is the beauty of studying in clinical importance. Whatever area question comes, you will be able to answer it also. And
Yes,
so
and
how
one more thing, actually, one more case, like patient farmer by occupation, initially presented with fever, headache, altered sensorium, subacute onset meningitis, meningoencephalitis like presentation. But before coming here, in outside hospital, they were initially giving a cocktail of drugs like steroids, acyclovir, as well as ceftriaxone like that. But after presenting here, we have done LP, which is suggestive of lymphocytic phagocytosis. And imaging we have done, which is suggestive of like a neuromyelitis, sir. Like it was spreading along the white matter cortical tract, and cerebellar abscess, like cerebellar micro abscess was there. So neuroradiological diagnosis helped here, and we started with meropenem as well as Septran, and the patient improved. So
and
like
you
making
with that paper, right?
yes,
And you got
yes sir,
first place of the paper, right?
yes sir,
In
yes sir,
Vellore.
yes sir. CMC I presented, sir. Actually,
Vellore.
yes sir. Infectious diseases in neurology was a very early, very easy. If we diagnose it, it is very challenging, and if we diagnose early and treat it, it is a patient can have full recovery also. So it's not like
Even immunological.
there is limited treatment. Yes sir. That
Yeah,
neuro
neuroimmunology is
treatment
growing
options has improved. Yes sir.
so vastly growing neuroimmunology. Now,
Yes sir.
many of the diseases are coming under neuroimmunology, including many of the
Yes sir.
dementias, many of the movement disorder spectrum. Everything is coming in neuroimmunology. So we
New
have a
drugs
lot of
for Alzheimer's, yes, spinal
like
muscular atrophy, and myasthenia
racing.
gravis. Yes sir.
And how, like, coming back to the exam, how was the preparation for phase two? Like I was telling through my like our Marrow page also, like you cannot specifically prepare for that. Was what my feeling was. You cannot specifically prepare for a phase two because this is something like your theory viva in your MD exam, because they can ask any question. If you have whole knowledge, the core concepts are there, you can answer. What do you
Yes
felt?
sir.
What is preparation? Any preparation, specific preparation for stage two? And you have anything to tell, like how to go for
Sir,
that?
first of all, I wish to thank my parents, my brother, as well as all my faculties of general medicine, Chikmar, sir, because we have been exposed to many clinical cases as a postgraduate, and it was very helpful in my phase two AIIMS interview. Because phase two is not, they will not ask theory, but it is mostly clinical case scenarios. So one imaging based question, one clinical scenario, and one neuro-opthal question. This was the most pattern, and 10 minutes time slot they will give, and then they will slot they will ask the question. So one clinical question what they asked was Beaver's sign was asked actually, and then the discussion went along the final segments. How will you localize, what condition it is seen, like that. And second is cherry red spot, and why it is cherry red spot is, what is the pathophysiology behind it, and what are the conditions you will see it. And then in each glycogen storage disorder, what are the neuro-ophthalmic manifestations, like that question went. And third was a clinical scenario of HSV encephalitis. So asymmetrical medial temporal lobe involvement, and if the patient reactions recurrence, what will you think, like NMDA encephalitis. So like that question was done. So in during my post-graduation days itself, neurology, like we've been seeing cases, many neurologic cases like GBS, Guillain-Barré syndrome, acute transverse myelitis, and autoimmune encephalitis, as well as myopathies, as well as this HSV encephalitis. So these kind of cases we have seen. So I thank all my professors of general medicine, Chipmer, so for giving me, teaching me, or giving me this exposure. So it was very helpful in my phase two preparations.
Yeah, actually, that is what, like when even though if you read Harrison page to page or whatever textbook or anything, that won't help you, particularly in neurology. That may help you to score some few one or two or three questions in MCQ, but altogether, but especially when it comes to the post MD exams, they are not sitting there to assess your MCQ knowledge. They are sitting there to assess
Sure.
your clinical concepts, And the best way to assess the neurology, the best way to assess the knowledge of a student is to ask how to approach a case.
Yes,
That
sir.
is the best way to access the knowledge. So they all know it very well. They are very senior faculties. They are the legends in neurology, and they knew how to ask the questions, and they want to assess whether if you are going to sit in the prime institution, you're going to sit the prime institution in the country, in the casualty or in the OPDs, whether you will be have the aptitude towards a patient, whether you have the aptitude towards a neurologist. That is what they want to assess, rather than reading page to page, rather than mugging up things. This is what is needed, especially.
And in my postgraduate days, like every Wednesdays, we used to have a model exams. So the final semester, they will present cases, neurology cases, which is a long case. And then the discussion will go on from history, like what are the negative history, how you are saying this, like that. And at the end of the history, we have to summarize the history, and then we have to localize neuroaxis. So why it is not lexopathy, why it's not radiculopathy, why you are narrowing it to this, like that they will ask. And with the examination findings, we have to demonstrate, and then they will confirm with the examination. So this was very helpful, because in phase 2 they were asking like that only. You have to tell them the neuraxis and why it is not that, and why you are suggesting this, like that. It was very useful.
That is what, like, if anyone out there preparing for INSS, this is my advice also. Like, even though NEET also same thing has to be there, especially in neurology, you need to have the proper concepts, how to approach a case. For approaching a case, you need to know the neurophysiology, neuroanatomy, and the basic things. So we have taken elaborately. I have taken elaborately in many of the areas. It's actually, the videos may
Yes,
be
sir.
lengthy, but length was there because the subject is neurology.
Yes, sir.
Without knowing the basic things, it is very difficult to learn neurology. Neurology is like mathematics. Without know the basic steps, you will be totally wrong.
Yes, sir.
And
After understanding the core concept, it was easy to follow, read up the things. So
yeah,
first, understanding the core concept and anatomy was very helpful, and then studying going through the videos and notes was very helpful. So I used to make my own notes after seeing the videos. So it was very helpful in the last minute.
yeah, that is what many were asking, like for PDF of Marrow notes and all. I feel like even if Marrow notes is there, you have to write your own notes, because that will
Yes,
help
sir.
you to learn better and revise better. It is very easy to revise your own notes rather than somebody else's notes. So
Yes,
always
sir.
it is better to create their. And how did you revise in the last minute before INI and NEET? How did you revise for the last
So
maybe last 4 5 days?
what things, while taking notes itself, I use different color pencils. It's like what things I know and what things I don't know, two things are there, sir. So what things I don't know, I used to write with a separate pen, and I'll put box or something or underline. So last minute I will see the things, like which I put box, like things. So initially, I was studying neurology, so whatever things I have know better, I was reading them, I was keeping them for last minute revision. So whatever I didn't know, I started with the subjects for NEET preparation. So for NEET SS, if endocrinology, RS, then cardiology, so other subjects for medicine part, I started with them, and I ended up with the neurology, hematology, and infectious disease. So it was very, since I know the concept very well, and I was prepared already for the quizzes. So infectious disease, I already, drug resistance infectious disease, for IDCon quiz I prepared, and hematology also I have prepared well. Studying itself, I studied extensively well, and neurology I was studying well, because it was a long case, and for medal exam I prepared, and I won that neurology gold medal. So for that it was very helpful. So what are things I don't know, I started with them. So it was time taking to understanding the concepts. So last minute, for the last 1 week, I divided it into 2 or 3 parts, and then studied the things which I know well. So it was
And
helpful, sir.
you were telling that you got some neurology movement disorder conference, some
Yes, sir.
quiz praise. So that was actually recently, like just
Yes, sir.
before the
That is in August month, sir. In
yeah,
August, in Kannur, Kerala, they were uh, conducting the Neurology
so
Movement Disorder Association, conducting the neurology, international neurology update quiz. The neurology
that
quiz, that
actually,
one also was helpful.
that actually helped. Like the quiz helped for the exam, and your exam preparation helped for the quiz. Probably that has
Yes, sir.
happened.
That time also, it took us an opportunity and revised neurology again. Dr. Fiju Chaco sir was the quiz master for
Yeah.
it.
Okay. And do you have any plans after this? Whether, like, now the scenario of neurology is changing. There is like
Yes, sir.
two type of neurologists are there. One is super specialist, and second one is super specialist going in this particular field. So,
Yes, sir.
would you have any plans for that, or just go through the general neurology part? Like, any plans right now? Like you are into the core into neurology, so you will know better than many other persons. Like because you were behind this, like you were participating in these competitions, you are preparing for that. So and you have a lot of exposure in JIPMER also. So do you have any plans like that right now?
No, sir. Currently, like neurology, I want to go through all the topics, like all the fields again and clinical scenarios. But one thing that I was inspired is this myopathies, sir. Because previously the concept was like even though if you diagnose LGMD or something, we have to send a genetic analysis and then only we can confirm. But now thing is neuromuscular imaging also has an important role in this one. So neuromuscular imaging based on which muscles are involved early and which muscles are involved late, they're able to diagnose it early before without a genetic, like genetic is very costly and it comes at the last stage. So with the clinical examination as well as with the neuromuscular imaging, even myopathies can be diagnosed as an early stage. So this one I was learned recently. Sir. This was very inspiring for me. So I want to read a little more detail in these topics. And another thing is this congenital myasthenic syndromes, autoimmune encephalitis. These things are very inspiring. And neuro-ophthalmology was very helpful. Like last minute, I prepared for phase 2, but it was very interesting, and I want to explore more on these topics.
Actually, yeah, as you're going to AIIMS, you will get exposed to all those things because all departments are there. And as you told, like neuroimaging, those areas are coming up, but still there are a lot of things needed further. Like
Yes,
it is, when you read it, seems to be very simple, but it is a little bit more complicated,
upcoming
especially
branches.
presentations are early. But these areas are rapidly developing, so that is definitely there. So I see. Actually, I see a very mature neurologist in you, even now
Yes, sir.
before joining the course.
Sir, and
You are into the
I thank
subject.
like for medicine part I watched Rakesh Nair sir's videos, sir. Like around 247 videos were there. So most of them I covered because whatever I read, I want to give my best and I want to give my 100% to the topic. So
Yeah.
it's not like only selected topics I read, but even though it was time consuming, the 4 months I medicine part also like 1.5 month, 2 months I studied. So the 247 videos, like each topic Sarah has given an outline and it was very helpful in going through them. So your videos as well as Rakesh Nair sir videos both were very helpful, sir. So thank so much, sir.
Thank you so much. And one more thing, like after your July exam, you got some around this much month. So how did you prepare for divided from general medicine and neurology? How did you prepare? Like whether you divide properly? How you have any balance of that? Like you keep a balance between neurology and general medicine?
So 2 months I prepared fully for neurology, sir. So like I was reading Harrison. Harrison definitely we have to read cover to cover, and then selected topics from Bradley, the images especially, then epilepsy, spinocerebellar ataxia, congenital myasthenic syndromes. These disorders are, if you are preparing for any SS, these topics are very important. So these things I prepared from Bradley. So 2 to 2.5 months I am preparing that. Then general medicine part, like for past like 1 month to 1.5 months I was preparing for general medicine. Since I prepared for NEET SS, it was very helpful. I was revising the topics. So, like two months for neurology, 2.5 months for neurology, and 1.5 months for general medicine, and last 1 month for revising like that.
Yeah. That revision is very, very important. Like
Yes,
what
sir.
you're telling, like you prepare your own notes, go through that, it will be very easy to revise rather than
Yes, sir.
following somebody else's notes.
And
And
cardiology, Ishan Sagar
answer.
classes were also very. Ishan sir class also was very useful, sir. Because during my MD postgraduate days, I was feeling difficult with cardiology, but I watched all the videos of cardiology of SARS class, and it was very helpful. So
So
cardiology,
you
neurology, as well as medicine, all three were very inspiring and motivation for me.
and you brought the marrow pack after your exams or before exams you bought it.
No, sir. During my postgraduate days itself, I bought, sir, because I was preparing for cardiology, neurology, medal exams, and final exams. It was
Okay.
medicine part. It was helpful. So, but like for a writing test, there was no time during postgraduate days. But after the exams, I got some time, so I was revising and writing tests also. So mock tests, it was very helpful.
Yeah. And it is very nice to talk with you because you are
Yes, sir.
so like you are into the subject even
Yes, sir.
before entering into you deserve this. You well deserved seat for you.
Thank you very
And
much, sir.
Thank you so much
Yes,
for
sir.
sharing.
I will.
I feel very
I
happy
thank
to.
my parents, my brother, and then my all my professors of general medicine, then my seniors and juniors, and especially Pushkar sir and Raghavendran sir. They are my seniors.
Pushkar.
Like currently they are in DM Neurology in Jipmers. They also guided me. Yes, sir. Pushkar Parani sir and
Uh,
Raghavendra sir. So I thank all of them.
I
Thank
remember
you very
interviewing
much,
him
sir,
last.
for giving this opportunity. Yes, sir. Thank you very much,
Thank you
sir,
so
for
much.
giving me this
All the
opportunity.
best for the future.
Yes, sir.
You definitely will grow up and become a very very super duper neurologist. Obviously, you have the core into that. Your mind is into that. All the best.
Thank you, sir. Thank you very much, sir.